Essentially, my role there, both roles have been all about driving member behavior, which might mean, for example, like getting people to close gaps in care, encouraging our members to get a flu shot. Or I was very involved in everything COVID because this was like 2020. That was really interesting because early on, people were like, wanted this information from us and they were like dying for it. They're like, when are the vaccines coming? And it made a quick turn into people getting mad about hearing
Yeah.
anything about vaccines.
Yeah.
Anyway,
That's super interesting time to be part
yeah,
of a pharmacy
yeah.
and healthcare company.
Hmm.
It's crazy. You are seen as a reliable source. They're coming to you for information, but also solutions. Not to get
Yeah,
like into that topic because it is a whole nother conversation, but
yeah.
we can actually let's
Different
scratch the surface.
podcast.
Well, I
Yeah,
don't mind scratching the surface a little
yeah.
bit if you don't mind, like in
Mm,
your role, driving traffic and information to consumers during a period like COVID, where they're looking to you for information and results and solutions for, in this case, vaccines and healthcare and best practices. And then when the narrative and the tone changes suddenly into fear or just, I don't want to hear about this anymore, or there's disinformation or a lack of transparency and understanding. There's a lot of things that would maybe upset people or turn them off from wanting to hear more about it. What kind of responsibility do you have, or how do you change your job when the sentiment of what the audience and society is, how their sentiment changes so quickly? What do you, how do you react to that?
well, I mean, we initially we had started communicating information about like um misinformation or trying to get around myths and things like that. I will say that was a bit difficult to do because just the the speed at which that information was going and the speed at which we could react were not on the same level. But I don't think that was needed to be our place anymore.